Funding for this edition of One-on-One with Steve Adubato has been provided by Valley Bank, ADP, always designing for people, Summit City MD, a provider of primary, specialty, and urgent care. Berkeley College, education prepares us to reach our dreams. Be inspired. The New Jersey Economic Development Authority, Johnson & Johnson, the Russell Berry Foundation, making a difference, the Healthcare Foundation of New Jersey, and by Suez North America, dedicated to shaping a sustainable environment. Promotional support provided by Meadowlands Chamber, building connections, driving business growth, and by bestofnj.com, all New Jersey in one place.
This is One-on-One. I'm an equal American just like you are.
The jobs of tomorrow are not the jobs of yesterday.
Look at this. You got this?
Here it is, man. Look at that.
Life without dance is boring.
I don't care how good you are or how good you think you are, there is always something to learn.
Do you enjoy talking politics?
No.
People call me because they feel nobody's paying attention.
Our culture, I don't think, has ever been tested the way it's being tested right now.
That's a good question. High five.
Hi, I'm Steve Adubato. It is our honor to welcome once again with us Carlos Rodriguez, who's President and CEO of Community Food Bank of New Jersey. Good to see you, Carlos.
Good to see you, Steve.
We're taping on the 22nd of October, moving into the Thanksgiving, the holiday season. We've had this conversation so many times before, but never in the midst of COVID. The greatest impact of COVID-19 on food insecurity issues and hunger related issues and people who are frankly suffering as we speak.
So they are suffering more than ever before. And as we turn the corner to this holiday season, it's the same story with a big magnifying glass over it, if you would. Over 40% or 56% increase in food insecurity. Over 400,000 more New Jerseyans are in need of food at this given moment. Those projections are now a reality. And at the same time, we're dealing with supply chain constraints that occurred in the beginning of the pandemic, and that unfortunately can become a reality again with a surge in COVID cases in the months and weeks ahead.
We talked in the beginning of this pandemic. So we're now 8 months in as we tape it. It'll be seen after that. Late October, we're taping. I want you to really help people understand. We use terms like food insecurity, hunger, but what is the actual impact on the lives of the people we're talking about, particularly the children?
Well, it's really about how can folks recover and start thinking about going back to opportunities if their primary focus is feeding themselves and feeding their families. So I keep thinking back as you ask that question, Steve, I keep thinking back the faces that I've spoken to on these long lines in our pantry partners or in the long distribution lines that unfortunately have been a reality during this pandemic, of a mom telling me, hey, I had savings. But after that first month, after that second month, that's it. I was tapped out. I can't make ends meet. I'm haunted, quite honestly, with the image of the mother pulling in her car up to one of our big distributions. And as we put a box of food in the back of the car, you see a little peak of relief through the rear view mirror. And you also catch the fact that there's a baby sit in the back of that car with a child there. And it just brings it to life. What we're talking about are families having a hard time sorting through this mess. This mess that's, keeping your family safe from a health crisis first and foremost, and then hoping that it doesn't turn into something worse because of inability to put something as basic as food on the table.
So someone watching, by the way, you can check out the website, Community Food Bank. You can volunteer, you can help in so many ways. It'll lay that out for you. But so many people right now are struggling themselves. They may not be hungry, there may not be food insecurity issues, but they're struggling. Talk to them as they are saying, hey, Carlos, I feel terrible for the people you're talking about, but I'm barely holding on myself. I got to take care of my own family. So it's not a great time for me to be helping anyone else? Talk to them.
Well, first of all, we're here to help you too, right? And so many of the families and neighbors that we're seeing we're exactly in that same situation. And hopefully we won't have to help you, but we're here for you. And if you visit our website, you'll find out very quickly where there's food available. You can follow us on Facebook. We're constantly posting distributions on a countywide level. And of course, the pantries that so many of you may have supported may now be a place where you can find a little bit of refuge for hopefully not too long until this thing passes, because it will
But
pass.
if someone can give.
And if someone can give, we still need the basics. Your food, if you can give to our local network. Funds really is the most important, because we're having to buy a disproportionate amount of food. We also need volunteers now more than ever. If you're healthy, if you can pass our online screening, then we invite you to sign up and register for some volunteering to help us get through this next season, if you would, of distribution and of helping our neighbors.
Final question. You're a not-for-profit, we're a not-for-profit. You and I, as respective CEOs and leaders, spend a lot of our time thinking about trying to strategize about raising money, keeping the dollars we have, cutting down on our budgets, getting those who have supported to come back and invest, et cetera, et cetera. How much of your life is spent thinking about dealing with fundraising?
You can't do one without the other.
No money, no mission.
That's it. No money, no mission. And the complexity behind this pandemic is that fundraising in a disaster is usually a sprint. The recovery is a marathon. So I'm hoping to do as much as that we can do and is needed right now. But I also have an eye on what's going to be needed tomorrow, next year. When this pandemic is, met with a vaccine, and people say, hey, it's over, there is going to be a recovery like no other. And data, a report that we just put out clearly shows it in terms of food insecurity and how long it takes post-recession. We saw it after Sandy. You know the story. So we're going to have to make sure that we are able to provide every resource available for the need right now, but also make sure that when, the quote unquote victory flag is waved in the pandemic, that we don't forget that it takes many of our neighbors who fall into need now a long, long time to recover. So we have to think about both.
Carlos, we're here. We're a platform. Our colleagues at NJ Spotlight News, they're a platform. The family of public television, public media, public broadcasting is here to be helpful in any way we can. Thank you, Carlos. All the best.
Thank you.
I'm Steve Adubato. We'll be right back.
To watch more one-on-one with Steve Adubato, find us online and follow us on social media.
We are now joined by Dr. Daniel Varga, Chief Physician Executive, and Michael Geiger, Vice President of Care Transformation Services at Hackensack Meridian Health. Good to have you with us, gentlemen.
Thanks, Steve. Good
to be here.
Dan, let me start with you. There's an initiative called Reopening America. What is it, and why is your healthcare network involved in it?
Well, Steve, as we got prepared coming out of the surge back in the spring, early summer, we had a lot of folks who were close to HMH who were kind of generally asking, hey, is it okay to bring my team members back to work? How should we think about reopening our business, et cetera? And as opposed to really just kind of doing that in an ad hoc fashion, we said, look, we've got enough expertise in the organization, whether it be communications, clinical expertise, et cetera, to actually put a package and a program together that can really help businesses, small and large, figure out how to reopen in the face of a pandemic that, as we all know, is still ongoing.
Mike, as I go to you, just let me disclose and clarify a couple of things. One, that HMH is an underwriter of some of our programming. Also, that I've done some coaching with physicians on their leadership skills. And finally, that Dan Varga has a background of Churchill Downs. Would you say the greatest what, Dan? The greatest?
Greatest 2 minutes in sports.
Kentucky Derby. Just trying to make all the connections here. Hey, Mike, do this for us. Tell us who is utilizing and working with you as it relates to Reopening America, because I know it's not just businesses, they're higher ed institutions as well. Go ahead.
That's correct. That's correct, Steve. Yeah, we have clients from all different industries. So we have schools and education that you've referred to. That's public school systems. We have private school systems. We have elementary schools. We have universities that we're helping. So really a whole host of clients, if you will, in the education realm. But then we also have a number of businesses, all different types of industries, right? A lot of landlords, if you will, where there's businesses within their business. And there's also a lot of small businesses that we're helping, and then some very, very large businesses as well.
Dan, what are the most significant obstacles, barriers, challenges, whatever word you want to use, to quote, reopening safely and smartly?
Well, Steve, you know, on the one hand, I think all of the folks that we've been working with are really, really concerned and want to diligently approach team member safety. And so these are folks who know they've got to have clean and disinfected workspaces. They have to be able to have their team members masked, socially distanced, and do all the sorts of public health things that we know help prevent spread, help keep people well. When our clients came to us initially, whether it be school, business, civic organizations, et cetera, it was a whole broad spectrum, really, of different asks. Some of them said, we think we got this. We think we got a plan. Would you all look at it and, you know, give us a thumbs up or a thumbs down on the plan? Others said, hey, listen, we're a complex organization. We really need a turnkey partner who can basically do a whole portfolio of stuff for us. But I think, Steve, at its core, as I said, these were folks who were really concerned about their team member safety.
You know, it's so well said, because just our production, we're a not-for-profit production company in partnership with public broadcasting. So all of our producers are in different locations. Our director, Elvin, Frank Brown, who handles our audio end. But we have a camera operator, Scarlin, who's been great with us. He's got a mask on. I had the mask on right before we started. And I'm not just making this about us. I'm just trying to use this as an example. Mike, is that what we're talking about, that every organization has to think through and get support from organizations like yours as to how to reopen safely?
You know, that's exactly correct, Steve. I mean, each organization needs to figure out how to best implement their strategies. I'll call them risk mitigation strategies. How do you minimize the opportunity for the virus to come in contact with any of your employees, any of your customers? And we want to help the businesses get comfortable in the strategies they put forward so that ultimately they can reopen. So that's exactly what we're talking about.
And, you know, it's so interesting, Dan, because we've talked about this before. Some of the seminars we've done at HMH with physicians on leadership, they're all remote right now. And my sense is, if we were going to practicing what we preach, in quotes, and for real, that we would only get those physicians together, those physician leaders, if they were physically separated enough, if we had masks on at the appropriate time and whatever, that the room was the right kind of room, the ventilation. Is that another legitimate example? Because we're not ready to do that, which is why we're remote, right?
That's exactly right, Steve. I mean, so that concept of practicing what you preach, if you go into the HMH corporate headquarters and go to the 8th floor at 343 Thornell and go to the boardroom, you'll find that there's a big sign on 2 of every 3 seats saying, don't sit here, so that you keep social distancing. Now that means we can't have a board meeting there. We can have some board members in the boardroom. The rest of them are remote. We can't have corporate leadership meetings there. We can have some of our corporate team members there, but the rest of us are all still remote. So I think folks are, realize they're going to be living in a hybridized sort of environment for a period of time, and they just need, the support and the stand with me sort of role that we can play with them.
My final question on this, for folks watching right now who say, you know what, I appreciate all the reopening America stuff, and that makes sense. But, you know, I'm going to play it out, and I'm going to, or wait it out and see how things play out in the winter, spring of 2021, and then we'll reopen. Is that really a strategic, smart plan?
I really believe it comes down to how comfortable each individual organization feels, right? So for some people, maybe that is the right decision. And if that's what they choose
to just wait it out?
If they believe in that, that's what to do. Everybody's entitled to their own opinion. What the program we've developed in the Reopening America program is to try to assist the businesses that would like to reopen to help them reopen in the fashion that they're comfortable. We're certainly not going to say, you know, you should stay closed or you should stay open. We want to help businesses that are choosing to reopen in their reopening efforts.
And finally, Dan, every organization, regardless of the type of industry you're in, they've got to think this through, and they've got to get the resources and the help from others, particularly in the public health world, who know best. Fair to say?
That's exactly right. I mean, when you look at the arc of this pandemic and where it's likely to go over the next 3, 6, 9, 12 months, a huge chunk of that journey is going to be, unfortunately, still relying just on the basics that we're using right now: masking, social distancing, hand washing, stay home when you're sick. And as folks who feel compelled to reopen to some degree start going down that road, we're here to help them make that happen. But it's going to be a journey for folks, Steve.
Dan Varga, Mike Geiger. Thank you, gentlemen. We'll be right back right after this.
To watch more One-on-One with Steve Adubato, find us online and follow us on social media.
Hey, Steve Adubato here. More importantly, one of my favorite guests of all time. We had him in Lincoln Center at the Tisch WNET studio, 66 in Broadway. Now he's remote. He's Mario Cantone. It says,
no, I'm at the studio in Lincoln Center. What are you talking about? I'm waiting for you. Where are you?
Listen, we'll be back one day. Don't worry about this.
No, I know that.
Hey, let me ask you something.
What?
How have you? We're late October. It'll be seen after. How are you dealing with this pandemic?
Well, look, I have anxiety and definitely some depression about this. I'd have that anyway, and also I'm a recluse anyway, so this was not that horrible for me. My husband came back from Seattle because he was running the theater there. Their husband, Jerry, he's been there. He was in Seattle, back and forth. I was there for a month, which was enough. And Seattle's delightful. I was there for a month. He was there a lot. And he packed up March 14th and came home. We've been in our apartment since then. It's been a lot. I mean, he's running the theater via Zoom, so he's the artistic
tell everyone about the theater, please. Put things in context.
It's a theater that he's the artistic director of a theater in Seattle.
Okay.
And he's, he works his ass off. He's on the Zoom calls every day. It's a lot, it's all a lot. But
can we stop talking about Jerry? Can we talk about you?
Yeah, I'm fine. I just have, we get along
pretty well. But I want to know about your work.
What?
Hold on. It's not like you're not working.
No, I work here and there. I don't work a lot. I did Pyramid. I went in studio and did Pyramid, which was really fun. Before this happened, though, like I did an episode of Mom, 2 episodes of Better Things, and an episode of The Good Fight on CBS All Access, and they were all great.
You did the finale, I think.
I did do the finale, and guess where my trailer was? A block away from my apartment. It couldn't have been better. I was like, this is great. I was like, I gotta get up at 6 a.m. And they were like, your trailer's on, the set is 24th and 8. I was like, what? Oh, it was the greatest thing.
You said something earlier on. We started this, but you also said the same thing in our last face-to-face interview, which, by the way, the chemistry between us is palpable. You feel it?
Where's my dinner when this is over? With a mask.
We will be able to do that at the appropriate time. But you said then, and you said again, I'm a recluse. People don't buy that because of your big personality. because of how charming and charismatic you are. What's the deal with I'm home? I'm a home. What is that?
I love being home. Look, this at first I was like, this is so equalizing and everybody is home and we're all on the same playing field. And I'm kind of digging this. I'm like, good, I don't have to be around anybody. I don't have to go anywhere. I don't have to talk to anybody. I don't have to do things. But, you know, then slowly I started to do some things here and there. I'll tell you, the Zoom thing is this my husband set this up. I don't know how to do this stuff. You know, I didn't get that gay. Oh, I didn't get that gay gene. I can't even, you know, I don't design. I don't know how to pick out a wedding dress. You know, women are always like, I wish you were designing my wedding. I'm like, you wouldn't want to design your wedding because I don't even know what I'm talking about.
You know, you said something else. You talk about the gay gene, by the way. What's interesting is that you said right before we got on the air, because I told you about our 4 kids, big range, age range, right? Mm-hmm. You're like, no way. And I said, you'd be a great dad. And you said, forget about it.
My husband and I were talking about that. I don't think I'd be such a great father. And I'd probably spoil them to death early on, and then I would resent them later. I know that would be the path for me. Absolutely. That would be my fraternal path. Than me? What'd you say? What?
I'm the same.
Are you the same?
I'm like, how these kids get so entitled? My wife said, are you kidding me?
Don't get me started about the youth.
What do you mean?
The children, because you know what? I'm going to tell you something. All the young ones, the young pretty ones out in the street, they're the ones that are not wearing the mask. They're not wearing the mask because they think they're immortal and gorgeous. You know what? I know you're pretty. And how about when I walk down the street and I see like a very attractive young man and I'll be like, oh boy, is he beautiful. And then I'm like, he's not wearing a freaking mask. And then the rage comes.
That bothers. Let's get this out of the way.
Wear the mask.
Okay.
It's out of respect.
Respect. Talk about respect.
Well, first of all, and wear the mask. This stuff, you know what? Your genitals are hanging out. What are you doing? What are you doing with that look? It's, you know, I have a friend who lives in Thailand, and he's from Connecticut though, but he's been home a lot. And you know, in Asia, they know how to wear a mask. And how about we used to laugh? I used to laugh at like all the Asians, not me, but you'd be like, why are they wearing a mask in the subway, even in New York, like before COVID? They were the smart ones. They always were.
Yeah. You know, you're political. We are doing this on the 22nd. There's a presidential election. We don't know who's going to win. It'll be seen after. Why'd you make a face?
Because it's just making me nuts. I want to go into a self-induced coma until November 3rd. I can't take it.
So this will be seen after. What's going to happen, Mario Cantone?
I don't know. I couldn't tell you. I cannot tell you. I just can't believe that...
you can't get the words out.
I can't believe that half this country, or even hopefully a little less than half this country, is still for Donald Trump.
What's your beef with the president?
What's my beef?
Yeah.
I freak out when he speaks. I don't like the way he speaks. I don't like his vocabulary, which is basically zero. I don't believe that he is for gay people. I don't believe he is for black people. I don't believe he is for anything but himself. That's what I believe. I do. And if he punishes you if you don't do for him. It's horrifying. Let
me ask you this: there's going to be a president either way. There's going to be 4 more years of Donald Trump, or there's going to be a new president-elect, Joe Biden, who will become president. Yeah. Kamala Harris, vice president. We'll see.
And our first Italian-American first lady, if Biden wins. Jill's Italian. Jill Biden's Italian.
Where are you going with this?
She's Italian. I love that. I think that's great.
Is she?
She's Italian.
Where did you hear that?
Read it, Steve. She's Italian. How about I met her one time backstage at the Meredith Vieira show, and I'm an idiot. This was years ago when he was vice president, and I looked at her and I was like, "You look so familiar to me," and I was ready to go on, and she went and she smiled, and then one of her Secret Service guys was like, "It's the second lady." I was like, "Oh my God, I'm such an idiot." I was like,
"Jill,
you look
so familiar."
Yeah, how about me? I'm the worst. This is called age.
No. Hey, listen, before I let you go, people look to you for so many things, not just your humor and your great personality. Tell me why we should be optimistic about our country. I'm being serious, Mario. I'm not screwing around with you.
And I'm the wrong person to ask. I feel very sad about it right now. So it's very hard for me.
Where's the silver lining, Mario Cantone? You got to give it to us.
The silver lining is sitting in front of the television watching Turner Classic Movies. It still exists, and they can't take that away from us. We can sit there and watch Judy Garland sing the trolley song several times. How cliche is this of this elderly homosexual to say this to you, the elderly heterosexual?
I thought you were going to say it was PBS, that we're the silver lining.
Well, PBS is great, too, because they show some good old movies, too, you know. They do.
And they have old anchors, too.
And you've got, look, great performances at the Met. I DVR it all the time. Great performances, period. American Masters. I love PBS.
I was just trying to tease a compliment for PBS out of you. That's all.
I'll show you my DVR right now. I've got like 13 operas on my DVR. If the box breaks, I lose the operas.
I love Mario Cantone.
Well,
and I've
Steve,
loved you for a long time.
I love you too, and thank you very much. Don't let it be too long, you know. Let's,
We'll see you again, my friend.
Come get me sometime, because I'm here in my hovel, just, doing it.
Stop
Wear your mask.
What?
Not you. I'm just saying it to the people. Yeah.
To the people.
To the people.
Mario, you take care of yourself.
You too, Steve.
Thank you, my friend.
Thank you, PBS.
I'm Steve Adubato. That's Mario Cantone. See how optimistic he is?
I'm so optimistic.
Stop it. Leave it alone.
Have yourself a merry little Christmas. Let the Yuletide.
Oh, my God. That's Judy.
That's my Judy.
That's Mario.
Yeah. Steve,
We're way over time. Just keep that in. I'm Steve. That's Mario. Next time. I love you guys. Bye-bye.
Bye, you guys. Bye.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by Valley Bank, ADP, Summit City MD, Berkeley College, the New Jersey Economic Development Authority, Johnson & Johnson, the Russell Berry Foundation, the Healthcare Foundation of New Jersey, and by Suez North America. Promotional support provided by Meadowlands Chamber and by bestofnj.com.
Are you looking to be a part of a dynamic, forward-thinking business service organization? At the Meadowlands Chamber, every day we connect, collaborate, and innovate, helping to drive business and economic growth in the greater Meadowlands and New Jersey. I invite you to visit our Meadowlands Chamber headquarters, an open office facility with access to resources for our members' businesses and networking needs. Together we will build the Chamber of the future and the next generation of leaders.